Hello and welcome to this short video explanation which accompanies this ESSR RADGames case. My name's Henry de Boer and I'm a clinical fellow in MSK Radiology here in Leeds Teaching Hospitals in the UK. So this is a sports injury case relating to a knee injury in a 24-year-old soccer player who sustained the injury whilst landing following a jump with some twisting at the knee and lateral contact from another player. So let's look through the case together and I'll point out the relevant findings. So starting with the sagittal T2 fat saturated images, we can see that there's a knee joint effusion as well as bone marrow edema in the posterior peripheral aspect of the lateral tibial plateau. As we come onto the proton density weighted images, we see that the medial meniscus, the PCL and the ACL are all intact. But as we come into the lateral meniscus, we can see here there is a radially orientated tear in the body of the lateral meniscus. Looking on the coronal images now, and focusing on that lateral meniscus, we can see here is that tear in the lateral meniscus, and there is also edema in the soft tissues at the periphery of this lateral meniscus, or at the capsular attachments, which we will review in a bit more detail later. And as we just scroll through these sequential coronal images, we just get the impression that there's some extra black tissue here at the inferior peripheral margin of the lateral meniscus, suspicious for a displaced meniscal fragment. And when assessing the menisci, don't forget to use the axial sequences because they can be very helpful, as they are in this case. And as you come down to the meniscus here, this black C shape of the lateral meniscus, we can quite clearly see this radially orientated high signal cleft, which shows us the tear very nicely. And as we scroll one slice inferior from that tear, we can see that displaced meniscal fragment at the inferior margin of the tear. So this is only very small, but this is a displaced flap of meniscal tissue. So coming to the answers now. So the main diagnosis is a lateral meniscus tear. Where is the meniscal tear on the axial images? That's in this region. Where is the capsular edema on the coronal proton density fat saturated images? So we've seen that, but just to go over that again, on the coronal images it's best seen here as edema in this region. And what's the morphology of the tear? As we've said already, that's radial. And which of the following lateral meniscal stabilizers is likely injured? And the answer to that will become obvious when we talk about what are the stabilizers. So you may all be familiar with the more posterior stabilizers being the popliteomeniscal fascicles, and they're three. So there's a posterior superior fascicle seen best on the sagittal images, coming from this posterior margin onto the popliteal tendon. There's posterior inferior and posterior anterior fascicles as well. And perhaps lesser known, but also important, is the tibial attachments of the lateral meniscus, of which there are two meniscotibial ligaments, a lateral and a posterolateral. And best seen on imaging is the lateral, which is in this peripheral aspect here, and there should be some black tissue, a thin stripe coming down as part of the sort of joint capsule attaching onto the tibia. And this is where we see the edema in the soft tissues at the periphery of the lateral meniscus and the edema within the tibial plateau. So the correct answer to this question would be the lateral meniscotibial ligament. And at the end of this presentation, there's some links to some really good review articles that talk about the anatomy of the lateral meniscus in a bit more detail, as well as a nice MRI review article giving the imaging findings that we're looking for. So which of the following incidental findings are present on this scan? So the eagle-eyed among you may have spotted already as I've been scrolling through, but best seen on the coronal images, there is this ganglion cyst within the ACL near its tibial insertion. And the last question was a theoretical question unrelated to this case. Which description best matches that of a Risberg rip? And this is a meniscal tear involving the posterior horn of the lateral meniscus, and it's seen at where the intermeniscal ligament inserts into the posterior horn, and it's vertically orientated and longitudinal. So the answer here would be D. So just to summarise again the findings on this case, we've got a lateral meniscal tear with a displaced meniscal fragment seen on the coronal and the axial images. And we've got capsular edema and a probable injury of the lateral meniscotibial ligament, as well as contusion in the lateral tibial plateau and an incidental ACL ganglion cyst, which is not of clinical relevance. So the key learning points from this case is don't forget to use your axial images in the assessment of the menisci. It can help you with the morphology and for assessment of displaced fragments. In this patient, the combination of the clinical history together with the patient demographics, as well as the capsular edema and the bone contusion, all make this an acute tear rather than a chronic or degenerative tear. And the lateral meniscus, in comparison to the medial meniscus, has weak capsular attachments, making it more mobile, but also less likely to tear despite this case. And we've talked briefly about the lateral meniscus anchors or stabilizers being the meniscotibial ligaments and the popliteal meniscal fascicles. And I would thoroughly recommend these two papers for further discussion and further reading on this. And these images here are just showing those relevant structures. So thank you for listening, and I hope you've enjoyed the case. We'll see you next time.